Hello everyone, I am Dr. Shrishti Pandey and I would like to welcome you all on the 7th episode of Assimilate Fireside Chat by Medvarsity. Today we have with us Dr. Bushra Khan. She's a renowned breast cancer surgeon practicing at Star Cancer Hospital, Hyderabad. Today, on the occasion of Breast Cancer Awareness Month, we will talk about different myths and facts addressing breast cancer, and our topic will revolve around that only. So, before diving into the topic, ma'am, if you could highlight a bit about your career, about your journey in the field of oncology.
So, as we all know, cancer as a disease is not just physically taxing, but mentally, emotionally, financially, and it affects not just the patient, but her entire family. So, right from the very beginning, after I had done my general surgery, I definitely wanted to pursue cancer surgery. And currently, I'm working at Star Hospitals with a team called Sankalp. We're a team of 11 doctors with all the specialities pertaining to oncology under one roof because it is a comprehensive cancer care center. We have medical oncology, surgical oncology, radiation oncology, and hemato-oncology all together. So far it's been good. It's some days we win battles, some days we do not. Some days are emotionally very taxing when we deal with cancer patients. But even going ahead and treating or curing even one of them it gives us immense happiness and joy. And being in a team, I think that's a plus point because you've always got someone to lift you up on the bad days. So yeah.
Very rightly said, ma'am. Ma'am, moving on. So, before starting this conversation, first thing that if you would like to address some common misconceptions about breast cancer which you see on your practice daily. So, if you would like to address those.
So as we know, there are certain risk factors to breast cancer, and one of the major risk factors is gender. If you are a female, you are much more prone to breast cancer as compared to men on the male gender. So this is a very common myth that we see because the world feels that men do not get breast cancer. But that is not true. Men also do get breast cancer, definitely lesser in proportion to women, but they are and they can get breast cancer. So that is one very common myth that we come across. Another common myth that patients come to us with is that they feel when we advise them a mammography for screening, especially according to the screening protocols, post the age of 40 years, once annually, you're supposed to get a mammography done. Patients feel that by getting mammography, because they are getting exposed to those radiations, they increase their risk of breast cancer. That is so not true. The amount of radiation exposure in a mammogram is very less. And with that much amount of exposure every year, you will not be prone to breast cancer. Another common myth which we find especially in the younger generation today is that they believe that certain kind of braziers in terms of the way they are made, be it the wiring or the color, can make you prone to breast cancer. So no, I would like to clearly say that no kind of brazier, it will not make you prone to breast cancer. A few others are that certain foods, eating certain kind of diets decreases your risk of breast cancer. So yeah, I would like to tell you that this is not a myth. Yes, having a Mediterranean diet, which is rich in legumes, which is rich in fruits, nuts, does reduce your risk of breast cancer because it is a healthy diet. They are healthy foods that you're actually taking in. If taken in the right proportion, they help keep your weight under check, decrease your risk of obesity, and hence they decrease your risk of breast cancer as well. So these are a few common ones on the top of my head that I can remember that most patients come to us with.
All right, ma'am. Ma'am, moving forward, if we are talking, addressing about breast cancer, one of the most key important question that everyone has in their mind is genetic.
Yeah.
So, according to you, what role does genetics play in either development of breast cancer or in the patient who are suffering from breast cancer? According to you, what role does genetics play?
So genetics plays a major role, and something like this was made famous by the Hollywood actress Angelina Jolie because she had a double mastectomy done a couple of years back, and that was because she was positive for the BRCA genes. So there are certain genes which after years of research have been found out to be clearly associated with an increased risk of breast cancer, so much that if you have that gene mutation, which means that if you have an abnormal gene in your body of that variant, you might be prone to getting breast cancer, even ovarian cancer, with an increased risk of around 50 to 60% in your entire lifetime. So it is the BRCA1 and the BRCA2 genes, and you also have the P53 and a number of other genes which are present, which are being researched as well. So yes, having a first degree family relative, having a history of a second degree family relative. What is first degree? What is second degree? A first degree relative would be your sister, your immediate sibling. A second degree relative would be your mother's sister, your maternal aunt or your paternal aunt, which is father's sister, and so on. So definitely having a family history in which your first or second degree relatives do have breast cancer or ovarian cancer history will increase your risk. So that is one aspect of it. And however, what I would like to, another myth that I would like to bust that people usually have is that they feel that they are prone to breast cancer only if they have a family history.
Yeah.
This is so not true. Only 10% of all the breast cancers have a genetic lineage, which means that they have a family history, which means that around 85 to 90% of all the cancers are sporadic, which arise out of a patient's lifestyle or a person's proneness towards it. So your lifestyle is what plays a much more major role than your genetics. But yeah, if you have a poor lifestyle and a genetic preponderance, which is genetically also you've got a family history, then it increases your risk by a very high amount. So yeah, so genetics plays a major role in breast cancer.
Very rightly mentioned, ma'am. Moving forward, ma'am, like you mentioned that there are quite a bit myths about breast cancer. There are certain symptoms as well which people often overlook, especially women. So if you would like to highlight few of the symptoms that if a woman comes across, she should understand first that she's suffering either from a breast cancer and what management she should take after that.
So in the recent years, one thing that we as doctors, especially cancer surgeons or cancer doctors, oncologists, are trying to promote as far as breast cancer is concerned is something which we call as breast cancer awareness or being breast aware. Now, what exactly is being breast aware? As simple as it states, being aware of your own breasts. Now, very importantly, we suggest what is called as a self-breast examination once a month to all the women, to all the girls. From the age of 20, start and never stop. Now, how do you actually go about self-breast examination? Once a month, preferably 5 to 6 days or 5 to 10 days post your regular menstrual cycle, stand in front of the mirror and look at your breasts. Make sure that what you see is what you've always seen and there's nothing abnormal. There's no change in color, there's no change in consistency of the skin, there's no visible lump, there's no nipple changes that are present, no swelling anywhere. And then with the flat part of these 3 fingers, you examine your entire breast area and the underarm area, which is what is called as the axilla. At any point, if you feel any lump or any swelling, which is not reducing, any skin changes or any redness, which is not going away, any pain in the breast, which is not subsiding, any nipple discharge, which is persisting and not decreasing, definitely come in immediately for a clinical breast examination by a professional doctor, and then they will take it from there on. Whether you are prone to it or not, if you have any of these symptoms, any of these changes, just come in casually for an examination. It may or may not be anything, but it's always better to be precautious. Because one thing we tell about breast cancer, which is absolutely right, is that if it is diagnosed in the early stages, then it's got a cure rate of around 95%, which is very high for cancer. So early diagnosis, the better management, and the lesser management, which is the lesser amount of treatment that you're going to need.
Ma'am, moving forward, since you have already mentioned about the symptoms, it is very important to understand the types of breast cancer. So, if you would like to highlight the difference between the types of breast cancer and how both the types or even more than 2 types, how this can be misinterpreted.
So definitely you have, if you majorly divide it in basic words, I would divide it into invasive and non-invasive breast cancer. What exactly is non-invasive and what is invasive? So the breast is made up of different components. You've got the ducts, the lobules, and the normal breast tissue which is present. So if the disease or the multiplication of the abnormal cells is limited to these ducts and these lobules, then it would be called as non-invasive. If it spreads outside it, getting into the surrounding tissue, that is what is called as invasive. This is a very basic terminology. So when we look at ductal carcinoma in situ, DCIS, that is what is considered as stage 0 of breast cancer. So if it is diagnosed in stage 0, definitely the prognosis, which is the fact that the disease coming back, is very less, and you have a very good prognosis of cure. You have a very high chance of cure. Then, depending upon the next few stages, which is stage 1, 2, 3, and 4, it depends upon the kind of breast cancer which is there and where all it spreads to. It could be just limited to the breast, it could have spread to the axillary region or the underarm, and it could have something which is called as distant metastasis, which is spread to the lungs, the liver, brain, bones, etc.
Ma'am, in the starting you have mentioned about how the extension of breast cancer is just not limited up to women. Even men can have breast cancer, and since this is a breast cancer awareness month, it is very important to highlight how even men can suffer from this and how they can actually understand if they are having this cancer or if they are suffering from this sort of problem.
So the main thing is that even men have some amount of breast tissue. So if you've got breast tissue in your body, you can have breast cancer. I'm not saying that they're prone to it, but it is not an obsolete phenomenon. Last week itself, we operated patient of breast cancer who had come in from abroad. So it is not like it is an absolute obsolete phenomena which is there. So what can men do? Definitely they don't have to be as conscious about breast cancer as aware, but in case you feel any abnormality which is there in your breasts in terms of swelling, skin changes, any nipple changes, definitely come in for a clinical breast examination. Do not ignore any changes that are present in the breast which are far from normal.
Ma'am, before we conclude this session, your few takeaway points for all those viewers who are watching, who are completely, nowadays social media is also into influence and people are making different sort of content based on breast cancer, how it can help and how it can, in a sense, create a misconception amongst all the patients. So if you would like to address that and your takeaway points.
So definitely, one thing that I would majorly like to highlight is cancer as a whole is not what it used to be. If you hear the word cancer, you don't have to fear. Many stages, many types of cancer right now, they have a cure and they have a high cure rate. Look, anyone who's going to tell you that they are going to 100% cure your cancer is lying. Because cancer, even in the early stages, can come back at any point of time. But not to scare you, it can also be cured and you can be on regular follow-up for it. Do not think that chemotherapy is your worst enemy. There's a lot of patients who actually come up to us, they fear chemotherapy because it causes hair loss. Like it has been seen that chemotherapy in media is associated with hair loss, but they don't show the fact that hair will come back. It's just that phase of chemotherapy which you might have to like undergo hair loss and a lot of physical, mental, emotional changes, but it'll all get back on track once you're cured. Also, I would like to tell people that please, all these chemotherapy or the surgery, the radiation therapy, everything, immunotherapy, target therapy, hormonal therapy, this has come about after years of research. So many things that before you go on to an alternative form of medicine which is there, definitely complete these treatments and be on regular follow-up, because we have seen really bad conditions of patients who leave the first line of treatment and they go on to alternative medicine and then they come back to us in stages which we cannot cure. The disease spreads this fast that they come back to us in stage 4. So while you're at an early stage, take the right choice, go to a good doctor, get yourself treated with the right modalities of breast cancer treatment, be it surgery, chemotherapy, radiation therapy, immunotherapy, hormonal therapy. The protocol will be decided by an entire team of oncologists and you can follow accordingly. Because breast cancer is one such disease which, if diagnosed early, is curable and you can go on to live a normal, healthy life like any other individual. So definitely my take to everyone would be conscious of what you're listening to. Do not believe everyone. Do your own research and go and take an opinion from a proper doctor, from a professional doctor regarding what exactly your symptom is and how to go about treatment. So yeah.
All right, ma'am. With this, I would like to conclude today's discussion. It was really wonderful having you here, and I'm sure our viewers will get to extract a lot of information from this discussion. And we are really looking forward to have you again on our platform.
Thank you.
Thank you so much, viewers. We'll be back soon with more such amazing and insightful session for all of you. Till then, happy learning.